Hello everyone, my name is Surya. Welcome to today's session of Nurse Talk. In this video, we are going to discuss some of the previously asked questions from different nursing examinations in India. So this question paper I got, this is from Sri Chitra Tirunal Institute of Medical Science, and the examination was held in 2023. So we are going to discuss about like 20 or 25 questions today, and we will go in detail about all the questions and also the options given. So you will get an idea about of what these options are about, and also in case if you are doing another examination, at least you will know how these questions are asked. Okay, so first question is, the nurses are participating in a health fair in a local mall and are giving influenza vaccination to senior citizen. What level of prevention are the nurses participating? This question comes from the subject community health nursing. And the question asked is levels of prevention. Okay, we all know we have 4 levels of prevention. So, what are the levels of prevention? First one is primordial prevention. Second one is primary prevention. Third one is secondary prevention. And fourth one is tertiary prevention. Coming to the primordial prevention. What is a primordial prevention means? And what is the difference between primordial and primary prevention? So, we are going to discuss it now. Primordial prevention means preventing the risk factor itself. Primordial means, remember, primordial prevention means we are going to prevent the risk factors. For example, I am not a smoker. Okay, I don't smoke. I'm not a smoker and I don't have any risk factors of smoking because I don't smoke. But still, if somebody is coming to me, you are coming to me and saying me or educating me about the problems of smoking or what are the dangers awaiting for a smoker, if you are teaching me that even without a risk factor, that is called primordial prevention. I am not in any risk, I don't have any problem, and still you are coming to me and teaching me about the risk factors or what are the problems caused by smoking, that is primordial prevention. Okay, so you are not preventing, what are you preventing here? You are preventing a risk of me, like we are preventing the risk factor itself, that is the primordial prevention. What is primary prevention? Primary prevention means I am at risk at the moment. I am at risk. For example, you can all relate to the example of COVID-19 virus or vaccination time. So, during the COVID-19, everybody is in risk of getting COVID. That time what we will do, the government asks us to go and take the vaccination. So, vaccination is taken to prevent the risk factor because the person is already in the risk. The person is already in the risk. If a person is in the risk, you are doing the primary prevention to reduces the chance of getting an infection. So remember, in primary prevention comes all the vaccines or immunizations. All these immunizations or vaccines will come in primary prevention. Coming to the same example, what I was saying again, if I am not a smoker and still you are coming to me and telling me, giving a health education to me about the bad effects of smoking, that is primordial prevention. If I am a smoker, I do smoking. If I am a smoker and you're coming to me and telling me that this is not going to help you, come on, you need to go and quit smoking and all these things. If you are saying me, that is primary prevention because I am already in the risk. I'm already in the risk. Okay, that is primary prevention. Remember one thing, that all the vaccinations and immunizations come in primary prevention because they are all in the risk. We are giving vaccination to people who are actually in risk. If you are doing your nursing studies, in the first year, before you go for the clinical placements, you will get some vaccinations from the hospital, from your university. That is because you are going to be in risk of getting infections. Okay, all the vaccinations, you can count on the example of COVID-19 or any vaccination given to the children, like small babies, like polio vaccination, measles vaccination, smallpox, or whatever the vaccination they are getting, they are all primary prevention because they are in the risk group. Okay, primordial prevention's purpose is to prevent the risk factors. Primary prevention's purpose is to avoid the risk because they are already in the risk. They are reducing the chances of getting the infection or any disease condition. Next comes secondary prevention. So what is secondary prevention? Secondary prevention means I already said, if I am smoking and you are coming to me and telling that don't smoke and you're going to be in problem on issue, but I never quit smoking, I kept on smoking, and then I diagnosed with a COPD. Okay, this is an example. Okay, I am diagnosed with a COPD, and now I got coughing and I have some breathing difficulty. I'm going to the hospital. I'm going to tell the nurse or speak to the doctor that I have got this breathing problem. I have got some issues in the lungs. And then they will ask me, do you smoke? I am saying, yeah, I smoke. Yes, I am a chronic smoker. Then what they will do is they will take me for an examination, maybe a chest x-ray or any other examinations like identifying my breathing issues like spirometry or those examination, and they will diagnose me. So secondary prevention means early diagnosis and treatment. Early diagnosis and treatment. Once the patient has a symptom, or once the patient is going to develop a symptom, even if the patient might not have a symptom, but still we are thinking that the patient might have this disease, and then we will diagnose the patient and start early treatment. That is a secondary prevention. What is a tertiary prevention? Tertiary prevention is a case where I never stopped smoking and I went to a condition where I cannot go back. There is only purpose of treatment in this is rehabilitation. Okay, there is a rehabilitation services or hospice or palliative care services awaiting the person. That is tertiary prevention. The purpose is to provide a understandable or to provide a decent life for a patient, because the patient's condition now is not curable. We are only providing comfort measures for the patient in this condition. That is a tertiary prevention. So now you know what a primary prevention and secondary prevention and tertiary prevention is. Yes. So we are going back to this question again to have a discussion or to find the answer. Okay. So the question was, the nurses are participating in a health fair in a local mall and giving influenza vaccine to senior citizen. What level of prevention are these nurses practicing? It is what level of prevention? It is primary prevention. Why is it not primordial prevention? It is not primordial prevention because we are not reducing the risk factors. These people are senior citizens. They are actually already in risk. And also remember, all the vaccinations comes in primary prevention. Okay, so that is the answer of this question. The answer of this question is primary prevention because this is about vaccination or immunization. Okay, and they are already in the risk. So moving to the second question, the nurse care provided that is supported by reliable research is known as. So this question is from the topic research, nursing research. So what is the answer of this question? We are providing a nursing care for a patient, and the care what I am giving to a patient is supported by a reliable research. So the options are evidence-based practice, theory-based practice, knowledge-based practice, and historical-based practice. If I am doing a research on something, what am I getting? I am getting a result with an evidence. Okay, we are not making any assumptions. Like we are making assumptions in the if you did research in your life, you know, in the first part of the research we are making assumptions, and the end part we are going to correlate that assumption with the result. That means we are getting a result. How did we get that result? We get that result by proof or with proof. That means we have an evidence. All the care we are providing for a patient is actually evidence-based practice. We are not just, for example, we are providing just physiotherapy for a patient. Does that mean we are just going to push the back of the patient? No, it is an evidence-based practice because it is evident that is the patient is getting help from this procedure. So the nursing care provided that is supported by reliable research. That means there is an evidence or there is an answer we got from the research is known as evidence-based practice. So now you know what evidence-based practice is. You know it is for police cases and all, we can say there is evidence. Evidence means a proof that this is going to work for the patient. We are not like vaguely going to the patient and doing something. No, we are not doing that. We have evidence-based practice behind every procedure or every nursing care what we are providing to the patient. So the answer of this question is evidence-based practice. Third question, who has decreased the mortality by improving sanitations in battlefield, resulting in the decrease of illness and infection? This question is from Nursing Foundation. So this question is actually very, very easy question. We all know the mother of nursing is Florence Nightingale. Florence Nightingale reduced the mortality by improving sanitation and battlefield. So primary thing of Florence, when we hear a name Florence Nightingale, we know that is the mother of nursing or the founder of modern nursing. And when we hear about Florence Nightingale, first thing we should know is Florence Nightingale was always giving importance to sanitation and also utilization of environment. That means the sunlight, proper good air, like the proper ventilation inside the room for a patient who is admitted in the hospital. So all these things were like Florence Nightingale were giving immense pressure to all these things when she was providing care for the patient. Sanitation, sunlight, air, and proper utilization of environment was her motto while providing care for the patient, and which is actually proved that it helped almost all the patients whom she were caring to. So remember, this question's answer is improving sanitation and battlefield is obviously Florence Nightingale. So to the fourth question, which of the following are 4 basic techniques of physical examination? So once we get a patient, we are going to do a physical examination for the patient. So what are the steps for basic techniques? It is inspection, palpation, percussion, auscultation. Okay, so in this question we have 2 answers here: inspection, palpation, percussion, auscultation, and inspection, palpation, percussion, auscultation. So either answer B or answer D is right. So when we assess a patient, first and foremost thing we will do is we will inspect the person with our eyes. We will look at the patient. We will look at the patient and see if there is anything wrong with the patient. And then we will palpate. We will touch the patient. While touching the patient, we will see if the patient has any warmth on the skin, or if there is any difference in the normal temperature of the patient's body. And also we can feel there is any abnormalities like any enlargement or edema in the patient's body. All these things can be assessed by palpation. Percussion means tapping on patient's body, especially on abdomen or on the back. We can percuss and see if there is any ascites or distension, abdominal distension can be, like if there is any fluid accumulation, they can be percussed and assessed. And auscultation is by listening. Listening means most of the time auscultation is done by the stethoscope. We can listen to the heartbeat of the patient with the stethoscope, or we can listen to the breathing sound of the person. So this is inspection, palpation, percussion, auscultation. These are the basic techniques of physical examination which we use in nursing. Okay. The next question is, which of the following terms denotes patient's inability to void even though the kidneys are producing urine that enters the bladder? Okay. So the patient's kidney is functioning properly. The patient kidney has no problem. But the thing is, the patient is unable to void. The patient cannot pass urine. That is the problem here. So this can be a bit tricky question. Look at the options. Urgency. Yes, urgency means the patient wants to go to the toilet all the time. Retention means the patient cannot urinate. Oliguria means reduced urine production. Dysuria means painful urination. Remember the terms oliguria, dysuria. Okay, so in this question, the question says the patient's kidney is functioning properly and producing urine, but he has difficulty to make voiding, like he is unable to void. When we see this question, the answer of the question is retention, because the patient has no issues with the kidney, but just the patient cannot urinate because the patient has a urinary retention. The urine is retaining inside the bladder. See, the urine enters the bladder and it is retaining inside the bladder. This condition is called urinary retention. So, what is oliguria, dysuria, and anuria? Okay, one of the favorite questions of nursing government examinations. Oliguria and anuria. I said oliguria means reduced urine production. Oh, I already said this question's answer is urinary retention. Okay, I'm going to oliguria and anuria because they were in the options. Okay, reduced urine production is called oliguria and no urine production is called anuria. No urine production is called anuria. But This is going to be very tricky because there is a difference in this terms. So in a normal adult, there is 400 mLs to 500 mLs. Sorry, 500 to 1000 mLs. Nearly 1 liters of urine. 1 liters of urine is produced in 24 hours. 500 ml to 1 liter of urine is produced in a normal adult for 24 hours. In a patient, or if the patient has urine output less than 400 ml. Okay, if the patient's urine output is less than 400 ml, that means reduced urine output, the patient is having oliguria. And in case if the patient's urine output is less than 50 to 100 ml, that is anuria. Okay, anuria means the patient's urine output is less than 50 to 100 ml. Oliguria means the patient's urine output is less than 400 ml. Okay, so I have seen a question in one of the major examination. I don't remember what it is, sorry. The question was, among the options below, what is the urine output of a patient who has anuria? That was the question. And option A was no urine. Option B was less than 400 ml. C was less than 100 ml. Or D was less than 500 ml. Okay. We learned that anuria means no urine. In the option there is no urine, there is less than 400, less than 100, less than 500. What is the answer? Answer is obviously not no urine. Answer is less than 100 ml. So I already mentioned difference between oliguria and anuria is, oliguria means the patient will be having urine output less than 400 ml, and anuria means urine output less than 50 to 100 ml. That doesn't mean no urine at all. It is not like no urine at all. The patient is anuria. The name says anuria, no urine. But it doesn't mean literally no urine at all. The patient is still producing urine, which is actually 50 to less than 50 to 100 ml. 24 hours. So that is called anuria. Very easy to remember, but still it can be a bit confusing. So I went to anuria and oliguria there because there is a question regarding the urination or voiding of the patient. Okay, we'll go to back to that question again so you won't get confused. So this question says, which of the following term denotes the patient inability to void through kidneys and producing urine that enters the bladder? So there is no issues with the kidney, there is no issues with the bladder. The only thing is patient is not able to void. That is because the patient has urinary retention. Okay, and in case if the question comes up like the patient is having a urinary output less than 400 ml, what does that mean? That is oliguria. And in case if the patient is having a urinary output less than 50 to 100 ml per day, that is anuria. And remember, anuria means, anuria the term means no urination, but the patient will be having a urination of 50 to 100 ml per 24 hours. That is anuria. And dysuria means painful urination. Painful urination is dysuria. Okay. Coming to the next question. Chain stroke respiration. So chain stroke respiration is, this is a topic from Nursing Foundation. So there are different types of respiration for a person. There are different levels, different types of respiration, and we will have a detailed discussion regarding the types of respiration in a class, which we might need require 30 minutes or 30 minutes or 1 hour to finish all the types of respiration. This question in here is chain stroke respiration. What is a chain stroke respiration? The chain stroke respiration is a respiration where the patient will be having apnea and hyperventilation. Apnea and hyperventilation together forms the chain stroke respiration. Okay, so what is that? Sorry, just a minute. Yeah. In chain stroke respiration, the patient will be having a deep and shallow respiration. I'll show you in the patient will be having apnea. That means the patient is not breathing for a long time. And then the patient is breathing very hyperventilation. Deep and shallow respiration. And then the patient is always going to another period of apnea. This is a chain stroke respiration. We all know a chain. Remember a cycle chain. It's going like that and then it will get into the hyperventilation period and then it's going back to the apnea again. So this chain stroke respiration is seen in the patient who is having, right, I'll write it here. Chain stroke respiration is seen in patients who is having increased intracranial pressure, increased ICP, and also the patients who is having a heart failure. Such conditions, chain stroke respiration is seen. Chain stroke respiration is like a period of apnea and then a hyperventilation. It is like an alternative periods of deep and shallow respiration. Sometimes the patient is having a shallow respiration, sometimes it is very deep respiration, again shallow. That is like alternatively the patient is having apnea and hyperventilation, and this is called chain stroke respiration, and it is seen in the disease conditions like increased ICP and heart failure. Okay, here are some other respirations, type of respirations given. There is like rapid respiration and difficult breathing. We all know what difficult breathing is. And then it is stertorous breathing. Stertorous breathing means like the patient is having something stuck in the throat and the patient is having stridor. That is stertorous or moist, like the patient will be having the moist present in the lungs and the patient will be having difficulty in breathing. Remember, the chain stroke respiration means periods of apnea and hyperventilation. And next, and very easy, very easy topic for all the nurses along all over the world. What is the angle of insertion of intramuscular injection? Obviously we know it is 90 degree. Intramuscular injection, IM injection is given in 90 degree angle. So what is the angle for intradermal injection? Intradermal injection is always given in 15 degree, and subcutaneous is given in 45 degree angle. And intravenous is also given in 15 to 30 degree. Okay, so we all know the angles of insertion of injection needles. The next question is the purpose of making mitten corners while doing bed making. Very easy question, but these options will give you confusion, but this answer is very clear: to keep the bed linen secure. So that's why we are putting the bed mitten corners. We are making bed mitten corners while doing bed making. The next question, one example of isotonic solution. So what is an example of isotonic solution? The normal saline which we usually give in a hospital setting, normal saline is 0.09% of sodium chloride. This is an isotonic solution. In case if this solution comes up 0.45% of sodium chloride, this is a hypotonic solution. And if it is more than 0.9, like 3%, it's a hypertonic solution. Remember, the normal saline what we use daily in our wards, 0.9% normal saline, that is an isotonic solution. Remember, it's an isotonic solution. 0.45 is hypotonic and more than 3 is hypertonic solution. Next question, the nurse is preparing to take a pulse on a patient who is receiving digoxin, which affect the heart rate. The assessment need to be completed prior to the medication administration. Which skill is correct while assessing the pulse of a patient? So digoxin. Digoxin is a medication which can increase the heart rate or the pulse of the patient. Okay, so we all know, have you used digoxin in your workplace? Have you used digoxin in your workplace? Digoxin is usually given to the cardiac patient, especially if the patient is having a heart failure or atrial fibrillation. This is the medication. This digoxin is a medication given for the patients. And when the patient is given with the digoxin, there is a chance that the patient is going to have an increased pulse rate. So we have to monitor the pulse of a patient before giving the digoxin. So we know that the patient needs to be checked, the patient's pulse need to be checked before giving the digoxin. In the options, what it says, radial pulse taken for 15 seconds, femoral pulse taken for 15 seconds, carotid pulse taken for a full minute, apical pulse taken for a full minute. We are assessing a patient properly before giving a medication because we don't want the patient to go for a complication. So obviously we are going to check the pulse of a patient for a full minute. So this option is out and this option is out. Okay, so we are going to check the pulse of a patient for a full minute. So obviously, what is the pulse we are going to do? Which pulse we are going to check for the patient? Apical pulse. For a patient who is having a digoxin, taking a digoxin, we will always do the check the apical pulse. We don't need to be checking carotid pulse in here. We are going to check the apical pulse, and that too for a full minute before administering the digoxin medication for a patient. Next question is supination. What is supination? Supination and pronation are two positions we give for a patient. So supination means we are sleeping on top of the bed, looking on the ceiling of the room. Pronation means we are looking down to the bed and looking at the bed sheet, like you are sleeping on top of the bed in a prone position. In supination, what is the positioning of the arm? That is the question. So the answer is turn lower arm and hand, so palm is up. The palm is to be up because the whole body is up. We are sleeping in a bed with the whole body up. This is our eyes and nose, and we are sleeping like this. Okay, sorry. We are sleeping like this, and in that supine position, lower the arm down. The arm should be on the bed, and the palm, and so the palm is up. The palm should be up. Okay, so this is a supination. Next question. Which of the following is an indication of a binder to be placed around the surgical patient new abdominal wound? So the patient has got a post-operative. The patient is a post-operative patient, has got an abdominal wound following a surgery. So what is the indication for a binder? Binder is to support, to be placed around surgical patient. What is the indication? Why are we giving a binder for a patient? Is that for collection of wound drainage, or to provide support of abdominal tissue, reduction of abdominal swelling, and stimulation of peristalsis? So the binder is used to support abdominal tissues while coughing and walking. That is the purpose of the binder, to provide it for a patient who has undergone a surgery. Next question. Which of the following is the most effective way to break a chain of infection? Very easy and very easy and very important question. Hand hygiene is the most important way to break the chain of infection. So let me ask another question from this same question. Hand hygiene was found by, or the hand washing, the process of hand washing was found by who? Who founded the hand washing? So very important question. This has been asked couple of times. Ignaz Semmelweis found in 1847. He was a Hungarian physician, and he was working in Vienna General Hospital, and he was a physician who found the modern medical hand washing, or modern medical hand hygiene techniques. Very important. This question has been asked once, that's why I'm saying it again here. Which of the following is the most effective way of break the chain of infection? Is hand hygiene, obviously. And hand hygiene was discovered, or the modern techniques of hand washing was found by Ignaz Semmelweis. He's a Hungarian physician, and he found it in 1847. Okay, Ignaz Semmelweis is the name of the Hungarian physician who discovered the hand washing techniques. So going to the second 14 question. When the patient develop dyspnea, what is the first intervention that has to be carried out? I think this is the easiest question in this question paper. So when a patient has dyspnea, what is the first intervention to be carried out? So remember, imagine you are lying on the bed. And suddenly you felt difficulty in breathing. What are you going to do? What is the first intervention you are going to do yourself when you have difficulty in breathing lying down? You're going to sit up straight. Yes, sitting up straight will increases the space between the intercostal space, and it enlarges the lungs, so you can take more oxygen in and helps to relieve your dyspnea. So that is a very common thing what everybody does. Even if you know nursing, if you don't know nursing, you have no connection with the medical field, if you're lying down and you have dyspnea, you are going to sit up straight, and that is going to help you. So in this question, when a patient develops dyspnea, what is the first intervention that is to be carried out is to elevate the head of the bed. We might know the answer, that is to elevate the head of the bed. But see this here, elevate the foot of the bed. If you are confused and if you are stressed, if you are in a lot of tension and you don't have enough time to finish your exam, you might put a mark in here, which is a wrong answer. That's why this is here. Okay, elevate the foot of the bed. Obviously, we know that is not the right answer. We are going to elevate the head end of the bed. So remember, to read all the options properly, take blood pressure. Why are you taking blood pressure now? I don't know. We don't need to elevate the foot of the bed. That is only going to make the condition worse. Remove the pillows per head. No, never do that. Instead, give more pillows and elevate the head of the bed. Okay, very easy. Other question. While giving oral medication, position is essential to prevent aspiration. So, what is aspiration? Aspiration means if a patient is lying down and eating or drinking, not just a patient, whoever it is, if you or me lying down and eating we can have a risk of getting the food aspirated into the lungs, and it is a fatal thing to happen. Okay, so while giving oral medication, the patient should be always in high Fowler's position. What is the need of this question here? Everybody know we need to sit up straight while taking the medication. What is the importance of question in here? So, if you don't know the terms here, high Fowler's, left lateral, SCTIMS, supine, you are going to get confused in here. Because if SCTIMS position, SCTIMS lateral position, everybody know, and supine position is lying up straight, and left lateral position is turning to the left side of the bed. So, high Fowler's is sitting up straight. So, if you don't know the term high Fowler's, learn it now. High Fowler's is sitting up straight in the bed. To prevent aspiration for any patients, we are going to provide them in high Fowler's position while giving oral medication or while giving food or while providing the NG tube feeding for a patient. Next question is, test considered as gold standard while detected COVID-19. Very easy, and everybody in the world, the whole world know about the test, that is RT-PCR. What is the full form of RT-PCR? Reverse transcriptase polymerase chain reaction. Reverse transcription polymerase chain reaction. RT-PCR test is the gold standard test for detection of COVID. Okay. Next question. The nurse is giving discharge instruction to a newly diagnosed diabetic. Nurse discuss with the patient that the dietary intake should be. This is an example of which healthcare service. So, we are going to see the options. The patient is already diagnosed with diabetic. Patient is newly but already diagnosed with diabetic. So the patient is diagnosis is over. So illness prevention will not come here because there is no point in preventing any illness because the patient is already diagnosed. Next one is restorative care. So restorative care will come here. No. Because we are not going to restore anything for the patient. We are not going to restore anything for the patient by providing more dietary intake, or we are not asking the patient to eat more for restoration. But instead, we are asking for a dietary intake which is more dependable for a diabetic patient. See, imagine if a diabetic patient will not be able to eat more carbohydrates, and we are going to ask the patient to reduce the carbohydrates and fat and to increase the intake of protein for the patient and fiber for the patient. So we are not restoring anything. Instead, we are actually promoting the health of the patient. The patient is already diagnosed and the patient's health is compensated. What we can do is we can do something to promote the care for the patient. Promote the care for the patient. Okay, we are doing the health promotion. What is a tertiary care for a diabetic patient? If the patient is undergoing a tertiary care, the patient will probably be amputated. Yeah, amputation. That is an amputation, and thereby the patient, we are going to provide rehabilitation. That is a tertiary care for the patient. In this case, we are providing health promotion for the patient because the patient is already diagnosed. So we are not giving any restorative or any illness prevention here, but instead we are trying to increase the health, promote the health of the already diagnosed patient. Next question, the multidisciplinary care model used to move patients effectively from admission to discharge. So, what is a multidisciplinary care model? Multidisciplinary means in a hospital, there are different groups like nurses, we are there, the doctors are there, the pharmacy is there, the social worker is there, and physiotherapist is there, and who else can be there? Housekeeping is there. Okay, all these different responsible persons come together to treat one single patient. This is called multidisciplinary team. In this multidisciplinary care model, we are getting a patient, admitting a patient, and moving the patient to discharge. What is this called? Team nursing? No. No, it is not team nursing, or it is not under any nursing, because this is multidisciplinary. It is not just nurses. Okay. Nursing process, again, no. Again, it's a no, because nursing is not coming here. It's a multidisciplinary. Everybody has their part to put forward. So it is nothing related to nursing. Interdisciplinary care. Are we providing any care for the patient? No. Interdisciplinary is right because it is multidisciplinary. Interdisciplinary is right, but we are not providing the care. We are actually moving a patient from admission to discharge by providing care. That is case management. Managing a case with group of people, with the help of group of people aiming to a same or single purpose is a case management. This case management involves all these people: doctors, nurses, housekeeping, pharmacists, social worker, physiotherapist. Everybody is involved in the case management, and they are all looking to one single goal of admitting the patient, discharging the patient healthy from the day of admission. So this is the multidisciplinary care model. So in case if they are asking about a multidisciplinary care model, remember, no single profession is not coming under that. Example, the nursing. It's not coming under, because it's multidisciplinary. Every member of the team is working forward. So the nursing or nursing process is not coming in there. Next question. Leading cause of cognitive impairment in old age. So, what is the leading cause of cognitive impairment? Stroke, we all know stroke is a physical impairment. Malnutrition is again nutritional impairment. And cardiac reserve again is a physical impairment. Cognitive means something related to the mental health or functioning properly in a day-to-day activities. Okay, so that is Alzheimer's disease. What is Alzheimer's disease? Alzheimer's disease is a neurodegenerative disorder affecting the brain and thereby causing cognitive or behavioral impairment for a patient. Alzheimer's disease is a disease condition where the patient will be having mainly 4 years: amnesia, apraxia, agnosia, ataxia. Okay. Amnesia means loss of memory. Apraxia means inability to do skillful activities. Agnosia means not able to familiarize with the familiar things, like not able to understand a pen is a pen and a knife is a knife. And ataxia means loss of muscle coordination. So we will have a discussion on topic Alzheimer's in another class. Okay, so Alzheimer's is a neurodegenerative disorder. And it's shows the cognitive impairment. So the next question: the patient need to learn to use walker. Which domain is required for this skill? So affective domains means understanding how to use. Cognitive domain means like using the brain. For example, we are using a computer with our cognitive domain. We are using a phone with a cognitive domain. Attentional domain means you are using a lot of concentration in particular thing. What is a psychomotor domain? Psychomotor means, psycho means we are using our mind, and we are again using our mobility as well. So psychomotor domain is used for a patient who needs to be in walker. So while walking, the patient has to plan first which arm is going forward or which side of the walker is going forward, and then he have to move it as well. So it includes the psycho and motor domain. So the answer is psychomotor domain. Next question is: the nurse is caring for a patient with pneumonia who has severe malnutrition. The nurse recognizes because of the nutritional status, the patient is at risk of producing what? Patient is already having an infection. Okay, patient is going to malnutrition. That is going to reduce the immunity of the patient furthermore if the patient is not eating and drinking properly. Will the patient go to cardiac disease? No, never. Will the patient go to diarrhea because of pneumonia? No. Insomnia. What is insomnia? Insomnia means difficulty in sleeping. The patient has a sleeping problem because of pneumonia and malnutrition. No. But the patient is going to a sepsis. Why? The patient is already in an infection. The patient is already having a very severe infection, which is not making the patient to eat properly, and the patient alongside with the infection is patient going to malnutrition, which is going to reduce the immunity of the patient furthermore, and then the patient is going to end up with a sepsis. Sepsis is a fatal condition, very, very important and difficult condition. We will discuss about it in another class. We need a separate class to discuss about sepsis. Another question, an elderly patient come up to the hospital with the complaints of severe weakness and diarrhea for several days. It is important to assess which one of the problems initially. Very easy. So the patient is not eating or drinking. Like patient probably is eating, but the patient has diarrhea for several days. So what is going to happen here? The patient is having severe weakness as well. The patient is going to end up in malnutrition, severe diarrhea, and the patient is going to end up in malnutrition. If the patient is having and is not drinking properly, the patient will end up in dehydration, and the diarrhea and weakness, everything will end up in skin breakdown, because the dehydration will reduce the amount of fluid in our skin and reduces the skin elasticity, and this skin elasticity can cause skin breakdown as well. So in this case, because the patient has got severe diarrhea and severe weakness, the patient is going to end up with malnutrition. That is the most important thing I'm going to assess if I see a patient with a diarrhea and weakness. Hope you got an idea about these questions and what the answers are, and also what is other options, what is the importance of other options. And I already mentioned that some of the terminologies I am not able to say now, because it might require another 30 minutes or 1 hour to explain in detail about all these things. So I will do a video in relation to that. In case if you want me to discuss any particular topic or any particular questions which you pass by when you are preparing for your exam, please pop it in my comments and I will get back to you. Thank you very much for watching the video, and see you in another session. Bye bye. This is from Surya. Bye bye.